This year's awardee of the Blessed Teresa of Calcutta Award is a woman, pediatrician, scientist, educator, author, public health advocate, and humanitarian who has devoted more than 6 decades of her life to service. Her lifelong devotion to medicine and service began in the 1930s when she experienced the poor state of healthcare in Marinduque as a medical student. Seeing firsthand the alarming death rate in children made her realize the need for better pediatric care. She knew then that this would be her life's mission.
Napakagaling siya mag-ano sa kids. Itatap-tap lang niya yung pero naano na niya. Alam na niya kaagad ang diagnosis. Napakagaling. May clinical eye.
She entered Harvard Medical School as a presidential scholar of President Quezon, the first time a woman was admitted to the prestigious school. After further training at Columbia University and the Billings Hospital in Chicago, she turned down numerous offers to practice in the United States, opting instead to come back to the Philippines at the height of World War II. Even as a young pediatrician, she immediately began serving others by securing permission from the Japanese to take out children of American and British prisoners of war and care for them in a school that she converted into a makeshift hospital. That first act was just the beginning of a lifetime of selfless sacrifices for Dr. Del Mundo. In 1948, while continuing to render her services to government hospitals, she started her own private practice in the little clinic in Mindiola. When her clinic flourished and was no longer big enough to care for her ever-growing number of patients, her dream of building a hospital for children was rekindled. In 1957, the Children's Memorial Hospital became a reality, devoted to the health and welfare of children. Building the 4-story hospital was not an easy task. It took immense dedication, resourcefulness, prayers, and even her personal savings to make it a reality. The very next year, she conveyed personal ownership of the hospital to a board of trustees when she converted CMH into a non-stock foundation. 4 years after the hospital opened, she was forced to sell her house so she could buy an elevator for the building. Then she was able to build a second building through loans from the GSIS and a private bank. And just as she acquired a new house, she once again had to sell it so she could build the hospital's adult wing. Despite all the challenges, she never once lost focus on her cause. In 1966, she founded the Institute of Maternal and Child Health. This gave form to her commitment to improve child health through an extensive public health program. This institution, like the hospital, is semi-autonomous, private, non-profit, dedicated to service, preventive medicine, training, and research. In 1972, the Institute of Community and Family Health came into existence. This is another testimony to Dr. Del Mundo's never-ending quest for improving the life of Filipino children and their families.
Many mothers bring their children when they have some difficulties that are not solved by other physicians.
From the late 1950s to the late 1990s, when the hospital took much of Dr. Del Mundo's time as president and administrator, she continued to perform various roles as teacher, teaching undergraduates at the FEU, where she chaired the Department of Pediatrics for 20 years. As a researcher, producing voluminous winning papers published in prestigious medical journals.
Putting up a textbook is really something very difficult. The competing textbook here is the American one, but Dr. Del Mundo inspired all of us, and we started on the textbook.
As a leader, becoming the president of the Philippine Medical Association, Philippine Pediatric Society, and many more. As an author, she was a newspaper columnist writing on children's ailments and was the editor-in-chief of the first textbook on pediatrics and child health in the Philippines. As recently as 1998, at the age of 86, she helped establish the Center for Tuberculosis in Children, the first voluntary non-government agency committed to the prevention and eradication of tuberculosis in children. In recognition of her dedication to helping others, she has received the Elizabeth Blackwell Award for Outstanding Service to Mankind.
With her contribution and with her award from abroad, like the Blackwell Award from Boston, then the people know that the pediatric training in the Philippines is really one of the best.
In 1965, the Ramon Magsaysay Award for Public Service by a Private Citizen in 1977, and the National Scientist Award in 1980, the first woman to get the distinction. Despite 70 years of medical practice, Dr. Del Mundo has never once thought of slowing down. Up to recently, she would still wake up every morning to hear Mass and do her rounds at the hospital, where she has been living in a simple room for the last 51 years. Now at the age of 96, and despite never having married or had children, she has cared for thousands upon thousands of children whose lives she has saved, and countless others whose beings she has touched. Her favorite motto has always been, "Mankind owes to children the best it has to give." Indeed, she has given her best, all for the sake of her beloved children.
Congratulations, you have been selected this morning as the recipient of the 21st Blessed Teresa of Calcutta Award.
Fish.